Hi, my name is Tsegaye Bekele, and today I'll be presenting to you a research work titled Increased Economic Hardship Due to the COVID-19 Pandemic Among Participants of the OHTN Cohort Study. I want to acknowledge my co-authors, Judith Odiambo, Adrian Betts, Wesley Oakes, Sergio Rueda, Anne Burchell, and Abigail Krog. When the COVID-19 pandemic started in March of last year, several public health measures were introduced to combat the pandemic. These measures in turn have resulted in increased economic hardship for people living with HIV. So we wanted to examine the extent of this problem and the characteristics of people who experienced increased economic hardship among OHTN cohort study participants. A brief background about the OHTN cohort study. It's a community-governed open cohort of people living with HIV and receiving care at 14 clinics across Ontario. Participants' clinical data are obtained from medical charts. Viral load data are obtained via linkage with Public Health Ontario laboratories. Sociodemographic, sociobehavioral, and psychosocial data are collected through annual interviewer-administered questionnaires. Since 1995, over 8,000 participants have been enrolled in the OHTN cohort study. Now about our methods that we use for the current study that I'm presenting. In May of last year, a COVID-19 module was added to the annual questionnaire to assess the impacts of the pandemic on OCS participants. The current study looked at whether participants experienced increased economic hardship because of the pandemic, and we specifically asked 3 questions. If participants have lost their job or their hours were reduced, if the coronavirus emergency led to loss of housing or homelessness, or the coronavirus emergency led to difficulty paying for basic needs, including food, clothing, shelter, and heat. We then classified participants as experiencing economic hardship if they answered yes to any of the above 3 questions. In the current analysis, we included 1,149 participants who completed the COVID-19 module last year. That's between May and December. We then calculated and summarized prevalence of increased economic hardship by key socio-demographic characteristics. Finally, we fitted multivariable logistic regression models to identify socio-demographic characteristics that are independently associated with increased economic hardship. A brief summary about the characteristic of the sample. The median age was 53 years. 3/4 or 76% were men. 67% identified as lesbian, gay, bisexual, or queer. The ethno-racial distribution of the sample shows that 61% were white, 21% were African, Caribbean, or Black, and the remaining 18% were distributed across different ethno-racial groups, as you can see from the slide. 63% of the sample were born in Canada. 62% indicated that they were not in a relationship. With respect to level of education, 27% indicated they have complete high school or lower level of education. About 40% reported that they have trade technical college level of education, and 34% indicated that they have completed university or a higher degree. And 3% of the sample indicated that they have children living at home. Now, looking at the prevalence of increased economic hardship by different demographic characteristics, overall, 25% or 1 in 4 of the participants included in this analysis indicated that they experienced increased economic hardship. Women were significantly more likely than men, 31% versus 23%. Prevalence also varied by age, with the younger participant reporting a high percentage and older participants reporting a lower percentage of experiencing economic hardship. Prevalence of economic hardship also significantly varied by ethno-racial group, with the highest percentage reported among Latin American participants, which is at 39%, and the lowest reported in South Asian participants, which was 23%. Prevalence also varied by immigration status and education. Participants who were immigrants were significantly more likely to report economic hardship, 30% versus 22% among those born in Canada. It also varied by education. It was higher at 29% among those with trade technical college level of education relative to people who have a university completion or higher level of education at 20%. So this slide presents the results from the logistic regression models. So we included variables that were significantly associated with increased economic hardship and unadjusted analysis into the models. Among women, immigrant women were nearly 1.7 times more likely to experience increased economic hardship than women who were born in Canada. Among men, the odds of experiencing economic hardship decreased with increasing age. Men who identified as gay, bisexual, or queer were 1.6 times more likely to experience economic hardship than their heterosexual counterparts. As you can see from the slides, the other variables that were included in the model were not significant. To summarize the findings, 1 in 4 of the sample, just 25%, indicated that they have experienced increased economic hardship due to the COVID-19 pandemic. In an unadjusted analysis, we found that age, gender, ethno-racial group, immigration status, and education were associated with increased economic hardship. In multivariable logistic regression analysis, we found that immigrant women were more likely to experience economic hardship than women who were born in Canada. Men who identified as gay, bisexual, or queer were more likely to experience economic hardship than men who identified as heterosexual. Younger men were more likely to experience economic hardship than older men. So, given these findings, we suggest that linking people experiencing economic hardship with available economic support programs should be considered as part of HIV care and services. And finally, we would like to acknowledge people living with HIV who organized to create the OCS. The OCS participants, interviewers, data collectors, research associates and coordinators, nurses and physicians who provide support for data collection, the Public Health Ontario laboratories for supporting linkage of the HIV viral load data, the OHTN core study is supported by the Ontario Ministry of Health. We would also like to acknowledge the OHTN core study team, the OCS governance committee, the OCS scientific steering committee, and the OCS staff who provide support for OCS work. Thank you. If you have any questions, you can reach me at the email listed above, which is tbekele@ohtn.on.ca. And you can also visit the OHTN core study website, which is shown here in the slide.